We could go on about the myriad problems of Medicaid, but we'll do well to conclude now that it drives up both costs and taxes for everyone. The fifth major problem is called in-state lock. Simply put, have you ever tried to buy less expensive insurance in another state? You can't. You know why? Because the government won't let you. Part of the reason for this is linked to the mandated regulations we mentioned earlier. North Carolina, New York, and Massachusetts each have their own government regulations on healthcare. The problem is that since there is no interstate competition for health insurance, within a state, at least none to speak of, virtual in-state monopolies emerge. In my state of North Carolina, it's Blue Cross Blue Shield. In another state, it might be Aetna. In yet another, Anthem. But in all those cases, it's not worth it to try to compete within another state in which one provider is already dominant. But people aren't dropping like flies in Idaho because they don't have North Carolina's insurance regulations. So why can't you get your insurance from a company in Idaho? The regulations are used to protect the monopoly power, but consumers don't benefit. Since regulations protect in-state monopolies and limit competition, costs are driven up. The sixth pathology of our healthcare system is unpooled risk. In other words, we currently have a number of fractured markets, which means it becomes increasingly difficult to have more and more people in a risk pool. There is a risk pool for the individual market, a risk pool for employer-based insurance, a risk pool for group insurance. Many times, a risk pool may only include the people in your small office. If your office is composed of older people in poorer health, you're probably paying more than you need to for health insurance. Now you know why your raise wasn't so big this year. Of course, the upshot of all this is, if risk is not pooled as it could be, it drives up costs. When one considers the 6 major pathologies of the U.S. healthcare system, you see exactly why the system, taken as a whole, is unhealthy. And what do all of these pathologies have in common? In one way or the other, they are all caused by government. So, if there are 6 major problems, what are their prescriptions? In other words, what's the cure? First, we have to do something about state mandates. One option for North Carolina is to do what a number of other states have done and offer mandate-light legislation. This means insurance companies are mandated to offer certain coverage items, but consumers can choose whether or not to include them in their plans. Another option is simply to take out as many unnecessary mandates as possible. This is tough, of course, because what is considered by one person to be necessary may not be for another. Nevertheless, there are certainly some things that a legislature might get consensus on. At minimum, however, any state legislature should require an actuarial study and cost-benefit analysis for mandating any new coverage item. Simply said, controlling mandates makes healthcare more affordable. Second, what about the inequitable treatment of employer-based insurance currently in the tax code? The best thing that could happen is for the federal government simply to change the tax code. That means that the federal government would give the same subsidy for people on the individual market as they get by getting their health insurance from their employer. Simple. If the federal government continues to sit on its hands, state governments could offer tax credits until which time as the federal government decides finally to take action. Such equal tax treatment could be offered either through a tax deduction, or better, through a refundable tax credit. That way, no one has an excuse not to get some sort of health insurance. Equalizing the tax code makes healthcare more affordable. Third, what do we do about overconsumption and the lack of price transparency? Expand the availability and use of health savings accounts. HSAs are a tax-protected account that allows people to save money for out-of-pocket healthcare expenses. That means if you aren't sick or injured, you get to save money with interest using pre-tax dollars, instead of using all your healthcare dollars on insurance. HSAs are coupled with a catastrophic plan, so that if you ever get seriously injured, you're still covered. Still, what you don't spend, you save, which means you'll be more cost-conscious. That is, you may pick the Prilosec over the Nexium, or think twice before seeing a doctor for a simple cold. Once more people think of healthcare dollars as theirs to keep, they'll be wiser about how they spend it. Indeed, an army of thrifty healthcare shoppers will eventually make care providers much more transparent and responsive about their prices. Until that time, we must find ways to encourage the use of HSAs and catastrophic plans, and let people negotiate prepaid arrangements directly with their doctors. Focusing on preventive care can also help with overconsumption. If people can negotiate lower rates in exchange for living more healthily, costs can be saved down the road. In short, expanding consumer-driven plans makes healthcare and health insurance more affordable for everyone. Fourth, what do we do about Medicaid spending and crowd-out? Before anything else, we must stop expanding eligibility. 95% of the poorest people, defined, say, as 200% of poverty, should be covered before any expansion beyond that income threshold. Then, we could offer refundable tax credits, subsidies, and private sector options like HSAs along with Medicaid. We should return to federal block grants that track the rate of inflation, which will take away the incentive for bureaucrats to find ways to spend more money on Medicaid. And of course, we should crack down on fraud. To sum up, reining in Medicaid will make healthcare more affordable for everyone. Fifth, what do we do about in-state monopolies? Easy. Government should allow people to buy insurance in any state they choose. The best way to do this would be federal legislation ensuring interstate competition. But at least state governments should take a hard look at allowing their own citizens out of the interstate lock. Smaller players attempting to gain market share in states with virtual in-state monopolies should band together and push for legislation that would open the market across state lines and create a more competitive environment. Allowing interstate purchases of health insurance drives down costs, making insurance more affordable. Sixth, what should we do about unpooled risk? Pooling risk through government is okay. It would be better than the status quo. For example, expanding associated health plans and high-risk pools are by and large good things. But nothing would be more effective than defracturing the health insurance market in order to allow it to evolve risk pooling mechanisms that would be unforeseen by bureaucrats. So, letting markets pool risk makes healthcare more affordable. What do you get when you practice holistic medicine? You get a healthy system. And that means healthier individuals and healthier families. That's because greater affordability means greater access. You get lower prices, portability, more options, higher quality, greater access. Just like with TVs, cars, cell phones, and sneakers, or anything else people want to buy. Now, let's recap. What are 6 ways to treat the pathologies of the healthcare system? First, do something about mandates. Second, change the tax code, leveling the playing field. Third, expand availability of consumer-driven plans. Fourth, keep Medicaid for the very poor. Fifth, allow interstate purchases of insurance. And sixth, pool risk. But the single guiding principle in any healthcare reform effort should be, whenever and wherever possible, expand consumer choice. Remember, many on the left understand that these reform efforts would go far in giving every American access to high-quality healthcare at an affordable price. The trouble is, a healthy market-based healthcare system is not their goal. For whatever reason, their ultimate goal is a socialized or single-payer system like that in Cuba or Britain. In essence, they are using the status quo like a vice. They believe that if they are patient enough, continuing all the while to worsen the distortions of the current system, the American people will cry uncle. In short, they are using the pathologies we set out above to let costs be driven up and up. Simultaneously, they will blame the free market for the failures created by government. When things are at their worst, they believe voters will be ready to accept socialized medicine. But you and I can prove them wrong. This completes Holistic Medicine, a presentation of the Civitas Institute. Thanks for listening.